The question 1. A 35-year-old patient has IOP of 28. Optic disc changes noted and no visual field difficulties are seen yet. What is your diagnosis?
IOP at 28 is a way above the normal limit, but there's no visual field defects here. That's the key.
Yes, this screams ocular hypertension. It's a precursor to glaucoma, but not full blown yet.
Correct. The answer is ocular hypertension. Great start, audience. Oh, Ashish has been leading the leader score, followed by Grishma, Hemant, Aisha, Shivani. Good going, guys. Moving on to your next question. History of blunt trauma to the eye and complaints of floaters and feels clot falling down in front of the eye. Which option is incorrect here?
I think floaters and curtain-like shadow, classic signs of retinal detachment. Microaneurysm, though, I guess. Not a hallmark here is that it's a diabetic retinopathy.
Exactly. The rest, scleral buckling, laser photocoagulation, shape 4 sign, they all fit in retinal detachment perfectly.
Yeah, yes, sir.
And you are right. The incorrect option is going to be microaneurysm, and it's not a hallmark. Well done. Wow. Wonderful. Ashish is leading the board with 171 points till now. We have Grishma, Hemant, Aisha, Sriraj. Good going, guys. The faster you click, the faster the points you'll get. Let's keep the spirit going. Question 3. A myopic patient complains of recurrent headache and frequent changes in glass power and has no difficulty in dim light. What treatment is preferred in this case?
Frequent changes in glass power suggest refractive instability. These are common in myopes, but no dim light difficulty actually rules out glaucoma.
Yeah, spot on, guys. Unless there's something structural, we don't intervene. This is a clear no intervention case.
Correct. Wonderful, guys. No intervention. Nice job.
Yeah, this is a good question to trick them.
It is. Now let's see. I think most of them have got it right. Grishma has changed the leaderboard, leading with the longest streak and on the top. Well done. Okay, fourth question. This is an image-based, guys. I hope the med geeks in you have found the answers to what it is.
Yeah, notice the optic disc cupping here, guys. That's a giveaway for, I think you'll get the answer easily.
Exactly. Options like cataract and macular degeneration, they wouldn't look like this. And the PACD typically involves corneal edema or narrow angles.
That's correct. That is correct. POAG is the right answer. Fantastic work. Let's see. Krishma. Followed
Yes, we
by
have Grishma, followed by Ashish, Sriraj, Hemant, Ankit Sharma, then Aisha, Tanya, Shivani, Karthik, and Kalai Vanan.
wonderful, wonderful. You all, every one of you are still in the race. All right, guys, we can change the table. Make the table yours. Choose a correct sequence of aqueous drainage from production to drainage site. I hope everyone knows this.
I think it all starts with the ciliary process. Then comes maybe trabecular meshwork and then Schlemm's canal, aqueous veins, and I think the last is episcleral vein.
Yeah, remember guys, a blockage at any point here can result in increased IOP and hence glaucoma.
Let's see. Let's see. Okay. Great work. Good job. Good job. The sequence is exactly what you voted. So good going. Good going. Let's go.
We have Ashish here now in the first place, followed by Hemant and Grishma.
Okay. Come on, guys. Come on.
I think this image shows filtration blebs, classic for trabeculectomy.
Right. Right. Trabeculectomy is a common surgical intervention for glaucoma.
Yes, it is. I think we just told them. All right. Good. Good one, guys. Good one. Okay.
Ashish is leading. I think Ashish has come prepared to win this quiz, followed by Hemant. Hemant was the previous quiz winner. Then Grishma, Sriraj, and at fifth place we have Aisha.
Aisha.
I think Grishma is a new player, sir.
Yeah,
Yeah.
Grishma and Aisha are new contestants.
Very good. New people and on top of the leaderboard. Good going. The second last question in front of you. A 30-year-old patient has been undergoing radiation therapy frequently and has come to your OPD to seek advice for any radiation harm on his retina. Which layer do you think is mostly affected?
I think radiation therapy damages the pigment epithelium, leading to issues like radiation retinopathy.
Correct. It's a pigmented layer that absorbs radiation and bears the brunt of the damage.
Most of these guys have got it right. Rod and cones is the right answer. Keep it up. Let's see how you did on the leaderboard. Yay! So we have a streak. We have a streak winner by Ashish, followed by Hemant and Sriraj. Come on, guys, come on. Each question, each answer will give you extra points. And you know, tables can turn anytime. The last, which will make or break you at this quiz. Look at this image and what is the sign seen?
I think this is a tobacco dust sign, also called as Kaffir sign, which indicates retinal detachment.
You can see pigmented granules in the anterior vitreous.
Right. Cotton wool spots and AV loops are more vascular findings, and scotomas are actually subjective visual field defects.
Right. Wonderful. So everyone has got it right. It is cotton wool spot. Good work, guys. Brilliant. Drum rolls.
Okay, we have Ashish as the winner for today's quiz as well. Congrats, Ashish.
Congratulations, Ashish. Well done.
Congrats, Hemant, Sriraj, Grishma, and Tanya as well.
Keep coming, guys. You will be able to win the rewards, the prized possession, and a reward in your name. Congratulations to everyone.
Yeah, we have Ashish was the winner of the previous quiz, which is Ophthal Quiz Part 2, I think on December 9th. And also he's the winner of today's quiz as well. Congrats to him.
Congratulations, Dr. Ashish. I think he's this person who has made it, Dr. Manoj. I think he's the
Yeah,
streaker, the third time winner.
yeah. It's
One,
good to see that. I think it's helping them.
yes,
It's a fun way to revise as well.
well it is, well it is. It's more to be engaged in a present situation, and I hope this quiz brings it all to you guys, and you have your full attention because you require it in the real exam.
Yeah, we had at the second place we had Dr. Sriraj, and at the third place we had Dr. Tanya.
Congratulations, both of you. You guys deserve the certificates, and we'll be definitely sending them to you. So, congratulations.
Yeah.
All right. So, guys, for today's quiz, we had total 8 questions. We have summed up the explanations for you. I hope it is all clear. Most of them are self-explanatory. If you have any kinds of doubt, feedbacks, anything that you want to come and talk, please feel free and do contact us. So, moving on with the explanation by today. So, we had the topic that is glaucoma. The characteristics of glaucoma is optic disc changes and visual field defects, and IOP may or may not be increased. These three characteristics are the basis. So, out of which any of these two, if they are present, it will definitely be a case of glaucoma. And when we talk about the IOP, so only in a case where IOP is increased, we call it ocular hypertension. And if it is decreased or a normal with a visual defect or an optic disc change, then we call it as a normal tension glaucoma. Now, most of you guys might have like little maths week. I know, med geeks, but the raised IOP is if ever more than or equal to 21 mmHg. So we call it as a raised IOP. All right. Dr. Manoj will explain you the next slide.
Yes, guys. Moving on to the next concept, we have retinal detachment. So retinal detachment is basically a separation of neurosensory layer of retina and the retinal pigment epithelium, which is nothing but the collection of fluid in the subretinal space. And we have two types, that is primary, secondary. Primary, also known as rhegmatogenous retinal detachment, whereas secondary may be due to like exudative or transudative. So the main symptoms which the patient complains of is floaters, then curtain fall like symptom, which is a like a hallmark sign symptom for retinal detachment. Also, they may complain of loss of vision and flashes of light, which is also known as photopsia. And coming to the treatment, we if it is based on whether the detached part is mobile or immobile. If it is mobile, we do tamponade procedures such as using the air, which is also called pneumatic tamponade, or using the silicone oil, or the most commonly done, I think, is scleral buckling. If the retinal detached part is immobile, we do vitrectomy followed by the fluid removal. And the three images here is of retinal detachment itself. The first one is a classical sign, which is tobacco dust appearance, also called as Schaffer's sign. And followed by, you can see here the image shows retinal tear, and the teared part is always a convex in shape. And coming to the following slide itself, we had a question on that which layer is more sensitive to radiation. I think this is a frequently tested topic in retina. So here we can see the most radiosensitive is the layer of rods and cones, whereas the most radio-resistant layer is retinal pigment epithelium. And also the layer which is responsible for generating the action potential is ganglion cell layer of the retina. And we can see that here in between the top 9 layers of retina and retinal pigment epithelium, we can see a fluid collection which is termed as a retinal detachment. I think Dr. Rupal will explain you this slide.
Okay, guys. So this is a this is a treatment that we do for primary open angle glaucoma. It's a surgical intervention that we do. The first is the laser trabeculoplasty, and it is done by Nd:YAG laser. So basically, the mesh is closed, and with the help of the laser, we open up the mesh. The second procedure is tubulectomy, over where the fistula is created between the anterior chamber and the subtenon space. In the laser, we selectively do it in the other eye also, as per prophylaxis. For the case of primary angle closed glaucoma, we do laser iridotomy, creating a hole in iris at 11 o'clock to 1 o'clock position. We do it to avoid diplopia, and also can be done as a prophylaxis in the other eye. I think, yeah, we are done with the explanations, guys. That's all for today's episodes of JuxtaMed. A big thank you to Dr. Manoj and Dr. RMD for their expert insights, and to you, our amazing audience, for your active participation.
Remember, guys, every case you crack brings you one step closer to mastering medicine and ophthalmology as well. Keep learning and keep exploring. And we hope you like this quiz format, and this is a fun way to revise as well. So we'll be waiting for your comments also. Thank you so much.
Yeah, guys.
The essence of today's video was to make you realize the importance of glaucoma and retina topic, because these two topics are very much asked in exams. If you see PYQs, many topics are asked from glaucoma and retina itself. I was making an analysis of the topics which were asked in last 2024 NEET-PG in both paper 1 and paper 2, and I was amazed to see that there were many questions from glaucoma and retina. So it is very important that you follow these PYQs, okay, especially for these topics, so that you don't lose any marks in the exam. And also don't forget to follow our links on social media for JuxtaMed quiz. So all these are given in the description of the video as well as in the next slide.